ratio of doctors to population in Pakistan is 1 to 1,254, whereas the dentist to population ratio is 1 to 20,839. It is estimated that 80% of all deaths and 90% of all illnesses in Pakistan result from diseases which are preventable. Pakistan's decaying and outdated public healthcare system has indirectly paved the way for the growing number of uneducated, untrained and self-professed Good Samaritans, also known as the street doctors.
If we think at the grassroots level, the number one reason is the ignorance or non-literacy, because the people do not have the right attitude and behavior that how and from where to get the treatment when they become sick. Other thing is the poverty, which is very much linked with the non-literacy as well. But the third and the most important thing is, which is at the level of government, is the absence of the some effective policy, and whatsoever the policy is existing, it is not being implemented as it should be.
These hazardous practitioners claim to cure and treat nearly every condition known to the world of science and medicine. Knowledge, they boast, is passed on by their forefathers, and therefore no degree or diploma is needed to practice.
I have been treating people on the street for 10 years. People want cheap treatment. I give it to them. It's simple.
Street dentists pose an acute risk to the public. They prefer to call themselves technicians of teeth, cleaning, refilling and preparing new ones, sometimes made from gold or silver. Using unsterilized instruments, these technicians of dental care are human health time bombs.
When we say what could be the possible risk, that could be in the form of drug resistance, that could be in the form of transmission of certain diseases, hepatitis B and C, and even the HIV/AIDS as well.
The exact number of street doctors across Pakistan is still unknown. Homeopaths and herbal doctors have been part of society for decades. The latest form of alternative medicine to hit Pakistani society is the mystical world of sages, striking speeches with sparkling bottles of various oils and glossy carcasses of reptiles and snakes, claiming cures for all diseases, including paralysis, arthritis and impotence, to name but a few. Here in the garrison city of Rawalpindi, Allah Bakshu has been practicing alternative medicine for 25 years, extracts this kind of oil from these uromastic lizards to treat patients for various different ailments. This particular oil costs just $1. About 80% of total healthcare expenditure in Pakistan consists of private expenses, and the majority of this is out-of-pocket payments. The prevalence of private practices and their incumbent costs helps to discourage people to get treatment for conditions that may become complicated and thus even more costly to cure.
In remote rural areas and in the peri-urban areas, people usually don't have any other alternatives. So the government facilities are not functioning there. The basic health units are closed. The private sector healthcare providers, those who are well qualified, don't think it's worth their while to go and practice there. So in many instances in the far-flung rural areas, these poor people have absolutely no option but to go to the local quack or the local dai or a traditional healthcare provider who is not trained in the discipline.
In the past, there has not been much support by policymakers and health specialists towards increasing the social security net. A national health plan which envisages free healthcare for all is seen by the majority as unattainable and utopian.
There's always an opportunity that these healthcare providers who are unqualified and who are operating in the field for profit can be trained in some way so that they can deliver a basic set of services. And that again requires harnessing their outreach through a number of institutional approaches.
For now, it seems the street doctors of Pakistan are here to stay, to eke out a living and continue to play Russian roulette with the lives of the lowest strata of Pakistani society. Adil Sabir, Press TV, Islamabad.